Hello, my name's Christine Facer. I'm a careers consultant at Leeds Beckett University and I work with the Faculty of Health and Social Sciences. Well, the first thing to remember about a job interview is, as I said on my presentation to the students and nurses before, is well done. If you've got through to the interview, you've done a good application form, whether that's CV, application form, but you've written well. So you've already provided some evidence to show that you can do the job. So you've been through whatever the different processes are. It could be HR, it could be an individual, it could be a whole raft of ways of looking at your application. But the point is, you're now in the interview situation. So the good practice is have that in your mind, first of all, that you now, your role, your purpose to be a star performer at interview is to get the job that you're applying for. Well, when you first walk into the interview, one is you should have calmed down first, or conversely, if you're a very sort of quiet person, is sort of try and get yourself a bit more relaxed and bouncy, or so you walk into the interview as though you own the space that's around you, which is what I said in my presentation. As an ex-employer, it's really attractive to see somebody coming in who's smiling, welcoming and giving good eye contact. So you want to be pleased, you want to go in and meet those interviewers. The clinical nursing jobs, I would say that they're looking for people who can perform in the role. There's always an element of they would prefer people to have values. So that I have had nurses talk to me, senior nurses, saying, well, if their skills aren't as good as they could be, but their values are the people that match our organisation, they say, well, we can work with values, we want the values, and we consider that to be more important than somebody who can sit an interview and give a technically, clinically perfect answer. We want to know that they've got values, and they want to know that they are caring and compassionate. So they have looked at the value-based recruitment, and they do understand about the 6 C's. I'd say that's probably the best thing to have in mind, and be aware of really what a good nurse is when you go into interview, and that will come across well to the employers. Okay, two do's I would say, first of all, is do the research before you've even gone through the door, because if you, it's an old maxim, isn't it, but if you fail to prepare, you're preparing to fail. And I never use that in presentations, but that's effectively what you're doing. You need to look at yourself, and this is still the same tip, is look at yourself, research you, and research that employer, that trust, that ward, the area where you're going to, and that will certainly give you the edge, because you'll know exactly what they're looking for. And then the second tip is to make sure that you've done some practice, not necessarily answered questions, paraphrase, but you've really thought about what they want and given yourself situations and maybe thought of scenarios, and because it could be that you could think of, well, when I did such and such, as we talked about the STAR technique, you can think about situations that will then be good examples for a range of competency-based questions or even hypothetical questions, because you can say, oh yes, well, when I did so and so. So actually think about who you are before you go in, and then being able to articulate with the techniques. And some don'ts is don't go in there and fail to prepare. And I know it's a sort of like double edge of the one before, but so many people think that an interview is a mystery, and it's not a mystery. You're going to be asked the competencies on the job, so do the preparation. So to not prepare is a really big mistake. And then don't go in there being too confident, overconfident, and that's something a lot of employers have said to me. Don't go in there full of bravado, and that, again, it could be a personality thing where you're overcompensating, but you know, have a bit of humility, you know, be a bit humble in there. Well, personality, it's an interesting one, that, because, I mean, as a accredited motivational personality assessor, I do a lot of sessions on this. Interviews really are not the best way to choose people, I don't think, because if you perform well, and we can teach you to perform well, it isn't necessarily the best way of selecting a candidate. So if, again, it sounds a bit round about the houses here, but if you're an extrovert and you love meeting people, you're automatically at an advantage when you go into the interview situation, because you'll be more likely to be bouncy and give eye contact. Whereas if you are a person who's introverted or quite shy, that can be difficult at first, and they're at an automatic disadvantage because an introverted person takes a while to warm up. They'll only show you their best once they feel comfortable. So interview tactics are, know your personality and work on it before you go in.
Thank you.